Hey everybody, it's your favorite doctor here, Dr. Tiffany Butler, and welcome to my YouTube channel. And in this video, I'm going to be talking about the TMJ dysfunction, alright? So temporomandibular joint dysfunction. So let's go over some anatomy so you can understand what I'm talking about. So the temporal bone, which is one of the skull bones, which is located right here on the side, and you have two, you have one on each side of your head, and the mandible. So the mandible is the jawbone. And when two bones come together, it makes up a joint, and these bones are connected by ligaments. So ligaments connect bone to bone. So this joint right here. So if you want to feel the joint or palpate it, you would just put your finger right here in front of this. This part of the ear is called the tragus. So put your finger right there, and then open up your jaw. Right, and you should feel an opening. Right, you should feel the bones sort of separate. All right, so that's the basic anatomy of this joint. All right. Now, some of the causes of TMJ dysfunction is a trauma. So if you have ever been in a car accident or fallen off a bike or got hit in the jaw, a direct trauma or impact to the jaw, that can cause you to have dysfunction. So dysfunction, meaning that the joint is not functioning properly. It's not doing what it's supposed to do, or it's having a difficult time doing it, all right, if that makes sense. All right, the other thing could be if you chew hard things all the time, so like eating hard candy. I remember when I was a kid, they used to have jawbreakers, and they used to have these big jawbreakers, and that can cause pain as well as using your teeth to open up things you shouldn't open, right? So if you're using your teeth to open up a I'm gonna call it a beer bottle, you're taking it like or even just opening up using your jaw to open up things when you should be using your hands, that can cause you to have TMJ dysfunction, as well as open up your jaw really wide. That can cause TMJ problems, as well as chewing, and I'm chewing excessively on one side. So I have a tendency, I'm right-handed, so I have a tendency to, when I chew, I always put food on the left side. And people chew on one side for many reasons. If you have dental issues, such as if it's too cold, or if you have cavities or bad teeth or bad gums, whatever the case may be, then you may favor one side or the other. If you chew gum, more than likely you always chew on the same side. You're not chewing on both sides, so that means one side is getting more pressure on it than the other side, so that can cause TMJ dysfunction. All right, and as well as, what was the last one I wanted to say? Chewing repetitively, I said that, and it'll come to me. It'll come to me. All right, so those are some things that causes TMJ. All right, the things that I mentioned before. I'll put it up on the screen. Now, as a chiropractor, you're asking with Dr. Butler, listen, you're a chiropractor. Don't you just deal with the spine? I'm going to tell you, no, because I can rehab any joint from the TMJ all the way down to your big toe. Why? Because these joints are pretty much made up of the same type of structure, right? And knowing what actually is causing the dysfunction in the joint helps me to treat you better, to know how to rehab it, right? Based on what was injured, all right, in the joint. So if it's actually the bones, or if it's the tendons, if it's the ligaments and things like that, then I know how to rehab you properly. All right, so as a chiropractor, one of the things I do, of course, spinal adjustments. This is what chiropractors are well known for. This is what we do. Spinal adjustments, the goal of the spinal adjustments is to place your body in the best position so that it can heal. It's to realign the joints, all right, so that you can move and feel better. That's the really basic understanding of chiropractic care. It goes beyond just the spine, right? I just told you I can rehab any joint from the TMJ all the way down to your big toe. So if this jaw is not moving properly, so when you open and close your jaw, and if it's sort of deviating, when you open your jaw, all right, let me see, let me show you. So what you want to do is put your fingers like this, right? Move my pen. Put your fingers right there in front of that. This is called the tragus, right? Put it there, open nice and slow. You could do this in a mirror, right? Nice and slow, you want to go. Now I can't see, I'm gonna look at the video just to see how my jaw is moving. All right, it looked pretty good. So you want, the jaw should drop down. Now if your jaw, when you do it, your jaw drops and it shifts either to the right or it shifts to the left, then you have some type of dysfunction. All right, now muscles tend to pull. All right, so if a muscle is tight, it's gonna pull. So if your muscle is tight on the right side over here, it's gonna pull that jaw to the right. All right, and vice versa, if it's tight on the left side, it's going to pull that jaw to the left. Now, you may not know what you're looking at, but that's one of the things I would do in an exam. If you come in my office, I would just see how well your jaw is moving. I will also feel to see if there's any crepitus, we would just call it clicking and popping. And that's something that some of the symptoms, excuse me, that people will experience. They not only experience pain, but their jaw may click, it may pop, it may actually lock up too. Like if they're talking, it may lock, then they have to like move it around, and then it like pops, all right? But they also have, a lot of times, most of the time it's pain. The pain is a result of inflammation being in an area. So any joint, if it's not moving properly, if it's dysfunctional, all right, you're going to have inflammation and swelling. Now, the reason why you have pain is because the particles and the substances that's inside of the fluid of inflammation and edema actually irritates the nerves. And nerves don't like to be irritated. And when it's irritated, you're gonna feel pain and discomfort. And the pain is a warning sign. So pain is absolutely necessary, because without pain, we would continue to do damage to ourselves, all right? So it lets you stop, pain stops you in your track. You say, hey, something's not right. Let me go get it checked out. Now, most TMJ dysfunctions, they're self-limiting, meaning they should go away within a couple of weeks or so if you're not doing anything to sort of exacerbate or make it worse. Now, if your TMJ persists, you know, I'm big on getting help sooner rather than later. So I always tell people, if whatever you're doing at home is not working, it has not gone away within 5 days, go see a healthcare provider. Go see someone who's specialized. So most people, if it's a jaw and face issue, they'll go see the dentist. And that's absolutely wonderful. You know, most dentists will treat it either through, and they may do soft tissue work themselves. They may show you what to do at home. They may give you medicine. They may give you injections, whatever the case may be. If you're more on the conservative side, such as myself, and you don't want to do any medicine, and that's fine. You know, research shows there's a great results with dentists and chiropractors collaborating to help treat people who have TMJ dysfunction, because the dentist is going to make sure that your jaw is moving properly in terms of the alignment of your teeth and things like that, and the chiropractor is going to do the same, right? We're not necessarily looking at your teeth, but we want to make sure that your jaw and your neck is moving good, all right? Now, we could go in, when I say we, I'm talking about the chiropractor go in, and we can actually go in and move the jaw for you, right? So do some passive mobilization or movement to the joint, the same way we do for your spine. Through the spinal adjustments, we can adjust the jaw. The other thing we would do is check out your neck, all right? Because these muscles in your neck, they connect to your jaw. This is why you're able to open your jaw, is because of the muscles that's connected to it, that's coming from your jaw to your neck, all right? If your neck is tight and stiff, a lot of times you may experience TMJ pain or discomfort, or even your jaw being shifted from one side to the other. All right, so that's another thing that chiropractors do. Of course, we do spinal adjustments, so we would not only adjust your jaw, but we also adjust your neck to make sure the neck is moving properly. All right, and what are some things you can do at home? You can seek help sooner rather than later. All right, avoid using your teeth to open things. All right, don't do that. Remember, if your pain does not go away within 5 days and you've done all that you can, please go seek the help of a licensed health professional, someone who knows what they're doing and knows what they're talking about. All right. Now here I'm going to talk about some benefits of seeking help, benefits of using chiropractic care, some benefits of using the chiropractor and the dentist to help you get optimal improvement. Again, if you don't take advantage of the help that's available to you, right, then your situation would get worse. So this is a consequence. So you want to go in, get help. 5 days. Hey doc, my jaw is not moving correctly. I'm having difficulty chewing, talking, all these things. I have pain. Not only is the pain happening in my jaw and my face, I'm starting to have headaches or neck pain. Go get help, all right? Because the joint is not moving properly. Medicine, again, is not the end all to everything. Medicine, if you're taking something like ibuprofen, it's going to control the inflammation, but it does not fix the fact that your joint is not moving properly, all right? So that's what you really want to address. Now, that's the benefits of getting help. Benefits of getting help is you get out of pain sooner rather than later, and the issue don't become chronic. All right. Now, some of the consequences is when your joint is not moving properly, particularly your jaw, and you're always chewing on one side and your jaw is constantly deviating. Over time, you can have abnormal wear and tear on your teeth. All right. So one side of your teeth may start to wear down more than the other. Now you have a whole other issue, right? So not only do you have jaw pain, but you start to have dental problems, which is going to cost you not only pain and discomfort, but it's going to cost you money and time. All right. So you don't want that. All right. So that's some of the consequences. And as well, if the jaw is not moving correctly and properly, you can start having pain in else places, such as headaches, such as ear problems, such as neck problems. All right. Hopefully you liked this video. Hopefully you learned something. If you liked it, go ahead and hit the like button. Hit the like button. Click share. Comment down below. If you have a health topic you would like for me to address or to make a video about, go ahead and just put it down below, and I'll do that for you. Alright, so that's all I have for you today. Hopefully again that you enjoyed the video. Hit the like, don't forget to subscribe, and remember, a healthy mind and healthy body creates a healthy life. Stay healthy.